And welcome everybody to this PenARC seminar where we're going to be talking about intergenerational practice. And we have the title of the talk is this lovely quote from one of the people that we have been working with on the project, which intergenerational practice is the beginning of an inclusive society. So I'm not going to be doing very much of the talking. I'm just, my name's Jo Thompson Coon. I lead the evidence synthesis team for PenARC. So what we're planning to do is to go through a little bit about the project, the summary, and some of our stakeholder engagement. And taking charge of that bit is Becky Whear, who some of you will know. She's a member of the evidence synthesis team, and she's leading one section of this project, which is from Exeter, and also Morwenna, who's one of the information specialists in the evidence synthesis team. And then we're going to move on to talk about a project that's happening now, an intergenerational project, Care Home Friends and Neighbours, and we're very fortunate to have Ellie Robinson-Carter joining us today to talk about that. So Ellie is part of the IGEN project, but she's also working on like a real life intergenerational project as well. So we're going to be hearing a little bit about that. And then we have Fiona Campbell, who's leading this project from Sheffield, University of Sheffield, and she's going to be talking a bit more about the evidence gap that we have created, and she's promising us an interactive experience, which is exciting. And then at the end, we'll have some questions. So I think I'm going to pass first of all to Morwenna, and we'll get started. Thank you.
Okay. Hello everyone. So this is the title of our evidence and gap map: intergenerational interventions for older people and children and young people. I'm one of the information specialists on the project. There's actually 4 of us in total, but 2 of us did the searching for this. The project is funded by NIHR Evidence Synthesis Programme, and it's a collaboration between Sheffield and Exeter. And there are 3 stages to it. There's the evidence gap map, which we're going to talk about, and then 2 reviews which are currently in progress. One which will be focusing on child outcomes, which is being run by Sheffield, and the other looking at the older people outcomes, which is being run by us at Exeter. And then an overarching report at the end. So the aim of the gap map is to understand and map out the research evidence and look for gaps in research on intergenerational interventions. So I'm just going to talk a little bit about the searching and then hand over to Becky. So 2 of the information specialists shared the search load. There were 18 databases that we searched in total. And I'm not going to just list them all, but as well as the usual health and social care databases, we also focused on child-specific databases such as child data and older adult database or old age databases such as AgeLine. And as well as this, we searched organisations' websites, so relevant organisations for both children such as Bernardo's and the Children's Commission, and also organisations that focus on older adults, so Age UK and Age International. So we also searched their website for any reports that might be relevant for our review. We included any studies, so that's qualitative and quantitative, and we also looked for additional studies through included studies and systematic review. So it was pretty massive when it came down to it, and I was glad there was 2 ISs, and we shared the load by dividing the databases up between us. And we retrieved 12,056 studies to review, which was bigger than we thought it was going to be. And this was information that came from 27 different countries. There were 26 systematic reviews in all, 236 quantitative comparative studies, 38 of these were randomized controlled trials, 227 were qualitative studies, and 105 were observational studies, and 82 were mixed methods. So it was quite a frantic few months going through all of that data. I think that's all I need to say about the searching. But just say that some of the studies only reported outcomes for one of the populations, but obviously we're interested in outcomes for both older adults and children. So I'm going to hand over to Becky now to talk a bit more.
Thank you, Morwenna. Yes, so like Morwenna said, it was quite a big load that we had of references. But we want to talk next about our stakeholders that we involved in the project, and there is quite a big group of stakeholders too. we purposely had a wide range so that we could cover the perspectives of those working with older and younger people, those that are likely to be working with these types of interventions or with providers of those interventions, or having to implement these kinds of intergenerational interventions themselves. So our broad range of stakeholders is across the two sites. So we have, as Morwenna said, our Exeter site was concentrating on, or will be concentrating on, the older adults side perspective of things, and the Sheffield site, led by Fiona, is concentrating on the children and young people. So we've got a broad range of people involved from both sides. We have got people from Cornwall Clinical Commissioning Group, Cornwall Council, Sheffield Children's Services, Sheffield Children's NHS Foundation Trust. We have representatives from UNICEF involved, child psychiatrists, early years and education professionals, and some representatives from Chili Pep, which is a young people's advocacy group based up in Sheffield. Then we also have representatives from several ageing related organisations. So for example, the Centre for Ageing Better, the Cochrane Campbell Global Ageing Partnership, which also has links to the World Health Organization, the Optimal Ageing Programme, and of course Only Connect, which Ellie connects us with. And Only Connect is, correct me if I'm wrong, Ellie, but Ellie, Only Connect is like a collection of members from local, national and international members of the care sector, or local government and schools, and other leading organisations like Generations Working Together, Humanitas, Deventer, and other organisations that work in this area, like memory cafes and things associated with that. On top of that, we also have our more academic colleagues from Sheffield and UCL and Oxford and Exeter, and they provide methodological expertise and topic expertise on areas of implementation science, ageing research, links with public health and care homes, and the Campbell Ageing Group, as well as children's services. So that is a broad remit of our stakeholders. We have met with these stakeholders only online so far. Our first meeting with them, we had everybody together on one online meeting, which was quite big. But it was important to have everybody in the same room because we wanted to discuss the protocol for the evidence gap map, and particularly the outcomes that we wanted to be looking at for the evidence gap map. And this helped us also to develop the structure for the map in the future. Our second meetings with our stakeholders we decided to hold in two smaller meetings, partly to give people a bit more flexibility about when they could and couldn't attend, and to have a more manageable group of people having a discussion together. And at these meetings, we shared the findings of the evidence that we had so far, with the expectation that we would be able then to, looking at this research, decide on what the research questions were that we were going to take forward for the next stages of the project. Anybody that couldn't go to those, any stakeholders that couldn't make those meetings, we tried to meet individually to make sure that we didn't miss out on their expertise, basically, and their impact on influence on how they could shape the project itself. So this quote that has already been mentioned by Jo earlier, intergenerational practice is the beginning of an inclusive society. This is from one of our stakeholders, and it really captures the conversation that we've had with our stakeholders. And that was centered around the fact that when we were talking about the outcomes that would be of interest, we were coming from a research perspective, which is why it's so important to have the stakeholders, because they told us about the outcomes they wanted to know about. Irrespective of if they were going to be in the research or not, those were the outcomes that were important, and outcomes related to the community were just as important as any outcomes relating to the mental health of children and young people and older people in those discussions. And both of those things were particularly important to the stakeholders because of the impact of, or to some extent because of the impact of COVID and how much influence that's had on both of these kinds of outcomes over the last few years. So one of the other things that our stakeholder meetings helped with was, as I said earlier, making a structure for the map. One part of that structure, or one dimension of that structure, was the outcomes that we were interested in, and the other dimension was the intervention levels. And Ellie really helpfully identified a tool that we could use to look at the interventions by level of engagement. So this is the tool. It helps to organise interventions by their level of engagement or interaction, ranging from level 1, which is just really learning about the other population, not having any contact with them, just having a better understanding in theory about them, to level 7, which is much more about being embedded in the community. So these might be interventions that are like a shared site where you have a nursing home or a care home, and they also have a nursery on site for children, preschool children. Or they might be settings where generations are living together. So there are some settings where there are intergenerational housing projects, and that would be included in this too. So in our evidence gap map, we mostly have research for identified in the levels of 4 to 6. So these are level 4s are interventions that don't happen on a very regular basis. They might happen once or twice a year, perhaps, for particular events or special days. Then we have level 5 demonstration projects. So these are projects that might have potential to be ongoing, but as they are set up, they are trying to work out if this particular type of intervention is going to work. And then in the level 6 interventions are ongoing intergenerational programs. So they're like the step above demonstration projects. They have been ongoing for either several times throughout the year or ongoing for several years, and probably part of a system of ongoing implementation. There are some, but in this organisation of interventions, there are some levels that are not included in our evidence gap map, and that is because of our eligibility criteria for the research that we were looking at, and that is mainly levels 1 and 2, and that is because in the evidence gap map we really wanted to know about interventions that brought the two generations together purposefully, rather than just learning about each other. Okay, Ellie, shall I pass on to you?
Yeah, brilliant, thanks Becky. Okay, so yeah, I'm just going to give a brief overview of a project which is taking place at the moment across England, which is Care Home Friends and Neighbours. So this is a national project run by the Linking Network and My Home Life England. It's apparently the biggest intergenerational project that's happened in England, sort of on a national scale. So it's quite exciting in terms of kind of development with intergenerational work in England. So the project is made up of 10 organisations, one of which is Sensory Trust, who I also work for. So I'll come on to that detail in a moment. And the 10 organisations meet monthly to kind of reflect on how the project's going in their different localities. And the aim of the project is to connect 10 care homes and 10 schools in those 10 different areas. So the idea is that overall 100 care homes and 100 schools will be engaged in the project. The project began, the kind of planning stages began last March in 2021, and then we had 6 months of planning, and then it's this academic year where we're delivering the intergenerational work. And you can see here on the map the different organisations that are taking part, and the organisations that are running the project. And as you can see, Sensory Trust is based in Cornwall, so we're kind of overseeing the kind of Cornwall side of the project. So a big part of the project is trying to foster leadership and ownership in both older people and younger people. So we run an advisory group as part of this project, which I'll come on to in a moment. So like I said, so Sensory Trust, so our whole organisation is about using nature as a tool for connection, and trying to make the outdoors accessible to everybody, regardless of their age, disability or social circumstance. So this project, tying into that, we're using kind of lots of different ways of connecting people through nature. We've also found out that we've got some extension of funding, so the project will actually carry on until the end of this year, to the end of December. So which is great news, because obviously with COVID, as you can imagine, there's been lots of lockdowns for care homes, and things have been slow in some instances. So because this project is kind of more about regular meetups, and kind of gradually trying to work from people meeting up less regularly to more regularly, we're kind of moving through the levels on this project. So just referring back to that level system that Becky was speaking about just now, what's been interesting is how the project's kind of started off with each group sort of learning about each other. So kind of looking at level 1, where there's been learning about dementia, learning about the young people, and then how we gradually move through those levels slowly as the project's gone on. And I would say at the moment we're kind of at level 5, so we're kind of in that kind of demonstration projects with the regular meetups, and a number of groups now working together in person. So to begin with, in terms of what activities we've been doing, so the first one is the remote activities. So again, because of COVID, we've found that lots of care homes especially have been going in and out of lockdowns quite regularly, so it's been quite challenging to plan in-person activity that's safe and that everybody feels comfortable with. So we've been very sort of creative with the young people and older people, thinking about how can we connect them remotely. So obviously with lots of different challenges, with especially with those living in care, especially with later stages of dementia, etc., and trying to think how can we make sure that each person has a valuable experience. So one of these projects, which is demonstrated on the left with the little girl holding the plant pot. So the children decorated plant pots with paint and kind of drew spring-like scenes and things, and then planted some daffodil bulbs and hyacinths, and then wrote some messages of hope in the soil. So it was a way of kind of giving the care home residents a bit of a focus over lockdowns. And they did this back in November, December time. So the plants started growing sort of into the spring, and the care home residents were able to put these on their windowsills. So those that aren't able to go outside into the garden can still kind of have a focus and be able to engage in nature. The second remote example I've got there is a Forest of Hope, which was a project that we developed over lockdown in 2020 for our dementia-friendly walking groups. And this is about kind of taking part in a tree visualization exercise and painting leaves from the tree, which have messages of hope on them, and then exchanging them, and sort of imagining that the raw mail is like the wind passing the leaves between the two different groups. So you can see there, one of the ladies in the care home is holding the leaf, and it's got a nice message on the back, which is personalised to her. And that particular care home had a tree they could hang the leaves from inside. So it's just ways that they can kind of build a connection remotely. And obviously, so there's lots of advantages of having the remote delivery, because I think it does something that's different to being in person. So I think for both groups, they've built a sense of anticipation around keeping in touch and sort of hearing from each other and looking forward to meeting in person in the summer. But some challenges have been around consent for images, for example, especially in the care home environments when a person is in later stages of dementia, and being able to kind of properly share faces and realizing how important that is, that people can see each other. So moving on to the next slide. So we've started doing a bit more in-person activity, which has been really great. So we've, for example, been working with the Leach Pottery. So this is an example of a session in a care home in Callington, where we invited 4 pupils to come along and make some ceramic tiles, which would then be displayed in the garden at the care home. So so it's basically this is about kind of, you know, working together and spending time and then creating something that can kind of be a reminder of that session. So it was really interesting kind of seeing how the remote activities and that kind of building of anticipation then came into play when they met each other, and how much they were excited to see each other and finally be together. And there's been a real interesting kind of talking point, especially around the young people, in terms of empathy, and kind of lots of questions being asked about, you know, how far can they walk, and how what do people feel able to do, and it's been really interesting how curious the young people have been about the older people. So yeah, I think that's pretty much it on that slide. And then just to kind of show you briefly, so this is a picture of our advisory group. So we meet monthly, and it's formed of a care home activity coordinator, we've got Peter from Humanitas, who said the quote that Becky's mentioned earlier, and we've got Ben, who's a head teacher, and some pupils from Calsock and Stoke Clemson School, and then Trevor, our ambassador, and Sharon, who's a community navigator based in Cornwall. So we have a real range of kind of support from people, and the idea of this group, this space really is to reflect on the project and to ask the children and residents what their perspectives are in terms of how they want to meet and ideas they've got for activities. Again, sort of nurturing that sense of leadership and making decisions about their project. And like I mentioned, especially the children have been very curious and asking questions like, are the residents awake enough, long enough for us to come and work with them? Like, how long will they be awake for? What are their abilities like, and really kind of thinking about what activities will really work for the residents. So it's been really lovely to watch their confidence grow with that. And yes, so like I mentioned, so we've had an extension in funding, and we've also got some national lottery funding sort of separate from this project to continue 2 of these links for a further 4 years. So at the moment we're sort of distinguishing which 2 connections are feeling the strongest and most kind of wanting to do that. So the idea being that we sort of shift from level 5 into maybe more of a level 6 stage, where we're thinking about embedding these activities and making it part of the kind of the rhythm of the school and the care home. So for example, some of these activities have started becoming part of people's Duke of Edinburgh experiences. So again, it's about finding ways of connecting up those different things that are happening at the school and in the care home environments, and how they can be integrated further. So yes, and I think as part of that, it's worth saying that even when our funding comes to an end with that part of it, so 3 or 4 years down the line, we'll be working really closely with the partnerships to make sure they're supported, and if they need a facilitator, that we kind of continue, we listen to that and we try and find ways of supporting that. So yes, I guess just hopefully that gives an idea of how these levels work, and kind of when you relate it to a project, and maybe how things can gradually build through the levels as well. I hope that's enough. Is that okay? I think that's me.
And I think next we're moving on to Fiona.
Thanks, Becky, and it's a real pleasure to be joining you virtually from Sheffield today. In this section of the talk, we're going to give you an opportunity to have a look at the evidence gap map, the first output from this project. And there's a URL link within the chat that hopefully you've been able to already use. If anybody has difficulty, just make a comment in the chat. What I suggest you do is that you have that open on one tab, and I'm going to be going through just some instructions to help you navigate the map before you actually start looking at it yourselves. So bear with me, but if you have access to it and can store it on a tab and just stay with the slides for a few minutes, that would be great. And if you have any difficulty with that link, please just shout. Do you mind moving? Okay, so for some of you, you may wonder what on earth is an evidence gap map. And for those of you who are perhaps new to evidence synthesis is a research methodology that we use to rigorously and transparently locate evidence, research evidence, to appraise that evidence and to synthesize it. And there are all kinds of different types of approaches we might use depending on the question that we're asking, and there are different types of outputs. And so an evidence gap map is under that sort of umbrella of evidence synthesis, and it's where we're going to be using rigorous approaches that are transparent in what we do. For those of you who are perhaps very familiar with evidence gap maps, with evidence synthesis methodology, one of the characteristic differences with an evidence gap map is that we start off with this framework, this matrix that Becky's already referred to, and we worked really extensively with our stakeholders to create that before we started. And it allows us to then code our included studies and to generate a visual interactive map. Now, it doesn't stand on its own, there's a report as well that's written, but it does give this really nice, very intuitive visual map. But crucially, it doesn't actually pool data. We describe it and summarize it, but we aren't synthesizing any of the included studies. And one of the reasons that it's been so useful for this project is that it's been a way of locating where there is a need for an evidence synthesis. So where we've got a collection of studies that haven't yet been synthesized. One of the other advantages of this type of methodology is it shows in a very clear way where there's gaps, both for primary research, so where we need to undertake some more primary research, and where, like I say, there is opportunity for an evidence synthesis of existing research. And that's exactly how we've used it. We've presented it to our stakeholders and said, this is what's there, and has helped guide what's going to be the next stage of the project, which is undertaking the systematic review. Okay, so Morwenna's already described the very rigorous process that we use to identify any relevant literature to include, and we ended up with 500 studies that we've included in the map. So this is what the map will look like when you open it up, and just to navigate you through it so that you can explore it for yourself. You've got these tabs along the top. The one that's just circled there allows you to view the records, and you can, once you do some filtering, you can click on that again. So it just gives you an idea of what the overall number of studies is included. And along the top, the row headings in this particular map is our outcomes. And so we've got the child related, then older person related, then joint outcomes. And you can see there's scroll bars both to the bottom and to the right hand side of the map, because it extends off beyond just that one screen. And then down on the left hand side, we've got in this map, it's the interventions, and we've used, as Becky and Ellie both referred to, these different levels as a way of capturing the different types of interventions within that come under the umbrella of intergenerational interventions. And you can use these tools as well to navigate the map. You can collapse it or extend it if you wanted, just to look, say, at all of the outcomes that relate to children and young people. Then you can collapse it down, or you can extend it to look at specific ones. So it allows you to navigate the map in different ways. And then you've got these cells, and you can see there that that there are both cells with no evidence, and there are also cells where you've got some dots, and the dots vary in terms of their size, as you can see, and the colour. At the bottom of the map, you'll also see the legends, and they will give you an idea of how our particular map has been designed, and will tell you give you information about what those colours in the cells refer to, and the size gives you an indication of the number of studies. And if you hover your mouse if you hover your cursor over the cells, then it will give you some immediate information about how many studies and what types of studies. Now, here what we've used as our colour coding are to indicate the types of study design of those primary studies that we've coded. Yeah, so if you allow your cursor to hover over those cells, you'll get some information. And that's the legend at the bottom of the page. And just to mention that when you see other maps, just check those things because they're not always the same on different evidence gap maps. You can locate the map is designed so that you can go straight to information actually about the primary studies. So that's the middle column there. You've got the actual references with a colour beside it, which gives you some of that information about the study designs. And then to the right hand side, you've got the abstract. Now, there is also a DOI link or at the bottom of the abstract. So if you've got institutional access, you can actually get directly to the paper, but that doesn't apply, depends on what institution you're in and the access they have and whether the paper's open access. But if you do, there is also that opportunity to have a link to the original paper. Also, along the top on those tabs, you've got an option to filter. And again, just another way of navigating your way around the map. So we've got a number of different filters that allow you to explore the evidence, including whether you want to focus on a particular age group, if you want to look at studies that have been done in a particular country, you may want to look at studies of a particular design, or you may want to look at those that are focused on a particular group, a particular population, or those that included a particular activity. And you can see how this could be a really useful tool perhaps for people who are going to be designing these types of interventions to look and see what else has been done. And these kind of filters allow you to be quite specific in locating the information that you're particularly interested in. So it has a utility way beyond just informing us what would be most suitable review questions to ask. So now's your chance to actually have a go and have a look at this initial output from our project. Here is an initial challenge. Firstly, can you find out how many studies, can you find the number of studies that are included in the map? We've already given you a clue on that one. But then also to see if you're able to locate those studies that have looked at interventions that have included children in the 0 to 5 category and have been sort of craft based. So that's a challenge for you if you want to use that. But do go now to the map, and also if there's any questions or at all or comments, and in fact this is just an idea of something to go and look at. There might be other things that you already think I'd really love to know about, whether there's been interventions with older people with dementia, for example, or ones I'm really interested in these schemes where actually there's shared living, students and older people, for example, and you already want to look at that. So have a look at the map, and it'd be great to get some of your feedback and your thoughts from an initial try of it.
Thanks, Fiona. That's great. I think, well, yeah, everybody, if you could have a go at playing, that would be great. Let us know if you've got any problems. And in the meantime, Ellie, did you want to have a go at answering Abby's question from the chat?
Yeah, of course. Yeah, so some of the activities do involve, but yeah, the young people and older people like doing physical activities together. And we find that things like walking, for example, can be quite hard for some residents. So it's kind of something we've realised is that doing something like I don't know, having some planters out on a table and people kind of planting and stuff and doing physical activity in that sort of sense. So it's almost like not the focus, but it's part of the activity, or cooking together, for example. Some of our one of our partnerships are doing a big buffet for the Jubilee. So they're kind of using herbs that they've grown to then make different food with and things like that. So I think just being creative about where physical activity comes in without maybe it being the focus. But there is one partnership who are planning like a games day in the care home garden. So they're having like a big noughts and crosses and things like that. But I imagine it would be a combination of residents taking part, but also some sitting back or maybe asking for someone else to sort of shift their noughts and crosses, that kind of thing. So it's just being quite creative with the different needs of the group, basically. I hope that answers your question.
I can add a little bit of that to that as well, Abby. I was looking at a study yesterday which is looking at multi-generational parks and how they can use those to pair an older person with a younger person to do physical activities and challenges together. that's as far as I got, but they do exist. Yeah. Does anybody have any questions about, well, any other questions or any questions about using the map?
I found it very useful, and I would like it's only a query or only a curiosity. How did you get the level? I mean, do you decide the taxonomy of the level, the level on the left, the intervention level, or is it in literature, like level 1, learn about the other age group, level 2, seeing the other age group but at distance, meeting each other, annual or periodic activities, demonstration? Because I see that for some levels there is no evidence or no articles. So just out of curiosity, just to know how do you?
The levels themselves come from some research done by Kaplan, and the Beth Johnson Foundation have sort of adapted them to create this particular, not a hierarchy, but a description, if you like, of the levels.
Perfect.
So that's the evidence for the levels, and then we're just saying that the evidence gap map, the evidence that we've included in the evidence gap map doesn't include some of the level 1 and 2 interventions, because our evidence gap map was more about actually bringing people together, and those higher level, the first 2 levels are less about bringing people together and more about learning about each other without having any contact. Ellie, did you want to add to that at all?
No, I think that sounds great. I think I guess, I mean, the way I came about this these levels was through the Generations Working Together training, which they run about intergenerational practice. So just something to say that if you're interested in this kind of work, it's a 10-week course, but it's fantastic, and they build it around what this was part of the learning. And I found it a really helpful way of sort of, because you've got intergenerational projects, and you've got other intergenerational projects that do something completely different, and I think it really shows that the embedding of intergenerational work in the community. So and like I said earlier, sort of it shows the progression from a more light touch to a kind of a more integrated way of operating intergenerational work. So, but yeah.
No, Enrico said it's the first time for him, and Abby has said I've only seen one before for COVID data. Do you want to say a bit about how new or not new they are, Fiona?
So yes, I don't know when the first one appeared, but they sort of, international development started sort of pioneering their use, really as a way of illustrating where existing evaluations were, and also for guiding funding for future research. But they're becoming an increasingly popular output, and I think it's a combination of just a nice visual tool that allows you to see something quite quickly. As Morwenna said, you quite quickly can see where the gaps are, but it does have these different levels so that you can then actually get to the original papers as well. So we're sort of seeing them being used across a kind of wide range of topic areas, not just in sort of social sciences, more in health sciences, and in fact we're developing them for tumour classifications as well at the moment. So just crossing quite a lot of different sort of boundaries and sort of interest areas, if you like. So yeah, I think that their utility is evident in the fact that we're seeing more and more of them, and quite often organisations like UNICEF and Youth Endowment Foundation host them, and they are really important tools for them to use in terms of guiding their funding projects.
Any more questions from anyone about things that you're finding when you're exploring the map, or other questions about the project? We haven't talked we've kind of based the presentation today on the evidence and gap map, but we are now working on a couple of systematic reviews, one based in Exeter and one based in Sheffield, So be happy to talk a little bit about what we're doing there, if that would be of interest, I think. Or if people are busy working, exploring the map, and whether that's enough for today.
We've had a suggestion from Mary that maybe we could share how to find the answer to the task.
Okay, so we've got a specific question here. So one of the things to do is to use the filters tab. So if you go up to your filters here, and I've already ticked them. So we're interested in looking at interventions for children in a 0 to 5 category. So I've just ticked that category, and we've got the focus. And I'm also interested in those art and craft activities. So that's how we. Okay, I'm just going to clear that filter update. Let's go back. It just seems to be running rather slowly, and I think that's, so bear with me. So those of you who did manage to work with it, is that how you went about it? Did you figure that out already? I'm just doing it again and see if we can and then update. Hopefully it'll take us straight then. So now all that you're getting on your map are those that have are meeting that filter. And the way that you can see, well, how many is that? Well, we've got 50 records. So you can explore them and get straight to the abstracts, or you can use your scroll down through the map, and that allows you to immediately find those that are going to be addressing your specific question.
Brilliant, thank you. I think we're coming to the end now, so thank you very much for the comments and questions. We're always here if you have questions after you go away. I think the link to the map is temporary because it's not peer reviewed and finalised. Yeah. But we're hoping that the report will be available soon, and we'll share that on our social media when it is.